I'd like to state that this is not a discussion of chemical processes, and this is not a discussion of femoral acetabular impingement. However, the prevailing modern-day theory is that many cases of primary osteoarthritis have been caused by developmental deformities of the femoral acetabular joint that we have acquired throughout the course of our lives. These deformities cause arthritis to develop from what is today called femoral acetabular impingement, according to Gans in 2008. So in the olden days, primary or idiopathic osteoarthritis was the term that was used for arthritis that began later in life for no apparent reason, perhaps out of just wear and tear or just living too long. Before we get fully into this discussion, I'd like to overview the definition of hip dysplasia. Too often I think that clinicians, when they talk about dysplasia, refer to the acetabular side of the femoral acetabular joint. But in truth, the dysplasia is defined as an abnormal growth or development of cells, tissue, bone, or an organ, according to dictionary.com. When we relate this to the hip joint, this is any loss of congruity between the femoral head and acetabulum. And being that every femoral acetabular joint in each human is slightly different from the next, one could reasonably argue that each of us has some bit of hip dysplasia within us.